According to a government report published this month, the White House pharmacy under the Trump administration, including stimulants and soothing, organized federal arrangements, leaving prescription pills, including stimulants and soothing, without insufficient recording. The Ministry of Defense General Inspector Office, White House's medical unit pharmacy operations in all stages, severe and systemic problems, were found. A witness discussed for DOD's 80-page report. Everything that took place in the White House clinic has never been written, has never been recorded. However, even when dealing with controlled substances, drugs with potential of abuse and physical dependence, the White House's medical unit, Drug Implementation Agency policy was compulsory by medical provider and deprived of patient information, prescriptions. According to the government report, 5 founded and systemic problems unda were found in all stages of pharmacy operations of the White House Medical Unit. 5 White House Medical Unit often filled prescriptions for controlled drugs such as ambience and Provigil. The White House distributed non-emergency controlled drugs such as medical units, ambiance and Provigil without verifying the patient's identity, he said. A request form in Inspector General's report shows that the White House pharmacy has ordered these drugs by thousands of people and demands brand drugs as routine despite arrangements that require pharmacies to stock cheaper generic equivalents. Between 2017 and 2019, the White House Medical Unit spent an estimated $46,500 for Ambien, which is 174 times more expensive than the general equivalent. In same 3-year period, unit also spent an estimated $98,000 for brand Provigil, which was 55 times more expensive than general equivalent. The Watchdog Agency concluded that White House pharmacy employees had little surveillance or no supervision, and prescribing practices at risk the health and safety of patients. 5 witnesses told DOD IG to senior employees to get their assistants often get their pills. A witness announced that some of his duties in the President Clinic Olur would be to pack controlled drugs in Zip-Kilitli Baggies before trips abroad, which will help senior officials who have routinely violate military guidance. The witness said, "That's why we would normally make these ambi and Provigil packages. And often they would be like 5 tablets in a zipper bag. He would come to get him by the clinic." Another witness described an example of a White House official as a separation gift. Dr.He said it was good for us to distribute Ambien. However, in the unit, he was authorized to do such things, he added. 5 DOD IG report examined the practices of the White House pharmacy between 20,172,019, when former President Donald Trump took office. 5 White House Medical Unit provided free medical care for more patients. The investigation found that White House's medical unit has Cr.